Hey guys, my name's Shashank, and in this video I shall be covering the orbit as well as eye movements. Starting off with the orbit, the structure vaguely resembles that of a pyramid, with the apex lying deep inside near the opening of the optic canal, and the base forming the orbital opening and is bordered by the eyelid anterior. Alright, now as you can see, the pyramid has four borders: the roof, floor, medial border, and the lateral border, with the superior border formed by the orbital plate of frontal bone and posteriorly by the lesser wing of the sphenoid. The inferior border or the floor, formed by the orbital surface of both the maxilla and palatine bone, as well as the zygomatic bone. Medially, there's the lacrimal, ethmoidal, sphenoid, frontal, and maxillary bone. And as you can see, the lateral border is produced by the greater wing of the sphenoid and zygomatic bone. Alright, so quickly going through the contents of the bony orbit. There is the eyeballs and associated structures such as the eyelids, lacrimal gland, extraocular muscles, as well as neurovasculature such as the optic nerve, oculomotor nerve, trochlear nerve, trigeminal nerve, in particular the ophthalmic division, which makes remembering the ophthalmic artery and veins easier to remember. And there is the abducens nerve, and finally the ciliary ganglion. Okay, so when inspecting the apex of the bony orbit, we will notice that there is a tendinous ring and three main passes by which structures can enter or leave the orbit. Starting off with the optic canal, there runs the optic nerve as well as the ophthalmic artery. Now, the ophthalmic veins are in their respective fissures. So the superior ophthalmic vein in the superior orbital fissure and the inferior branch in the inferior orbital fissure. And now moving back to nerves, in the superior orbital fissure, there are the branches of the ophthalmic nerve. So an easy way in which I remember it is NFL. So N for nasociliary, F for frontal, and L for lacrimal. And there are also nerves involved in the movement of the extraocular muscles. And these would be oculomotor, oculomotor, trochlear, as well as abducens. And finally, in the inferior orbital fissure, not much, just two more nerves. Zygomatic being one, and sympathetic nerve. Alright, so finishing off with the movements of the eye, which are mediated by the extraocular muscles in the orbit, in particular the recti and oblique muscles, with the exception of levator palpebrae superioris, which is responsible for the superior eyelid movement. There are four recti muscles, out of which all of them originate at the common tendinous ring and attach to the scleral surface of the eyeball at the region corresponding to their name. So They are the superior, inferior, medial, and lateral rectus. They all are innervated by the ocular motor nerve, with the exception of the lateral rectus, which is innervated by the abducens nerve. As for their movement, the superior rectus is involved in elevation, inferior depression, lateral abduction, and medial adduction. All right, so moving on to the oblique muscles. There are two oblique muscles, the superior and inferior oblique. In contrast to the recti group of muscles, they don't originate from the tendinous ring. Furthermore, they aren't straight like the recti and have an angular approach and attach to the posterior surface of the sclera. Now, with the superior oblique, it originates from the body of the sphenoid bone. Its tendon passes through the trochlea and attaches to the sclera posterior to the um, superior rectus. Its innervation is the trochlear nerve, which is cranial nerve number 4, and its action is predominantly in torsion, as well as a little bit of depression and abduction. With the inferior oblique, it originates from the anterior part of the orbital floor and attaches to the sclera posterior to the lateral rectus and is innervated by the ocular motor nerve. And its actions are predominantly extorsion as well as elevation and adduction.